world is facing a deadly coronavirus pandemic with no concrete solutions still in sight. India imposed a lockdown in the end of March and the economy is still opening up. Will the coronavirus pandemic change the medical world forever? Will there be a medical revolution? And how has the medical fraternity treated it so far? To talk all that and much more, today we are joined by Dr. Prathap C Reddy, founder chairman of Apollo Group, which is one of the largest private hospital systems in the whole world. Welcome, Dr. Reddy. So what do you think about the way India handled the coronavirus pandemic? Could we have done something better?
Suddenly, if you come out, if you think of a road accident, suddenly if you say a car in front of you or a lorry in front of you, the best that you can do, you can do. I think this is what the government has done. Is just totally head-on crashing yourself. They have taken many steps, bringing back our citizens from various parts of the world by sending our aircrafts and bringing them back. Then bringing the lockdown early enough. Then of course we didn't have the testing facility. That also they ramped up as quickly as possible. As they ramped up the medical equipment for PPEs and the ventilators, they ramped up the diagnostic equipment. And as I told you, the last statement by Ashwardhan, our WION Health Minister, and he said that we have now the largest testing facility in the country. So all that they've done, but it needed time because it was not something that we could manufacture. Our people now will manufacture and send it to the rest of the world. But at that time, when we have never heard of this, never heard of coronavirus, we have heard, the other infections, but this I think came as a great hit. As I told you earlier, I have never in my life seen any virus of this type producing such a global catastrophe and a pandemic which is made people panic. So I think we should now say government has done its best. We will cooperate and see that we will take enough precautions to save ourselves from this and then go early enough because the healthcare is available. They now must compliment the public healthcare. The tremendous way they have enlarged. They're putting beds, 1,000 beds, 2,000 beds, beds for stay. All of these they have done a remarkable thing. And as private healthcare, we've all done our very best. Each one of us have given what they immediately could do. Because it's like you woke up with it. First you woke up with the fright, then we woke up with the challenge being healthcare players. And I think we all did well. Well, as I said in the beginning itself, I adore all the doctors and healthcare system. First, of course, the public healthcare system. Many have sacrificed their own lives for the sake of their brotherhood. And similarly, the private healthcare have also cooperated with this and given its best.
Now, news of vaccine development are coming and some vaccines are expected by the year end also. According to you, how long will it take for normalcy to return from both medical and economic point of view?
I don't read literature like some of our research team does, but certainly I'm seeing a lot more, hearing more from the media of the number of centers and the scientists that are working around the clock to bring an effective vaccine to stop this pandemic. But as I said earlier, our experience with earlier vaccines, whether it's smallpox, whether it's polio, with all of these, we have succeeded in arresting it. But the vaccine development took not months, not weeks, not months, but it took years. But today they are now thinking of bringing it in months. And there is a hope now. They are already doing clinical trials, at least 6, 7 things. And I told you, at least I know 3 institutions in the country who are in a big way trying to bring the vaccine out. They're ready, and they say within a matter of the moment they have the wherewithal, they will produce hundreds of thousands of vaccines available for not only for our nation, but as I said, the same institute has promised that World Bank that they will give 100 million for the developing countries. So I think there's a great hope that we have the capability to produce, but I think what is needed is for the vaccine to be to come out saying, yes, it will clinically make effective to develop resistance, to prevent the disease, not modify the disease. I think what we're looking for a vaccine is to see that we can prevent a corona attack on us if we have taken the vaccine early enough. So this is still under trial, but there are great hopes because, as I said, the efforts is global. Still, advanced countries, UK, US, Japan, they're all talking about a lot of things. China is talking about saying they are ready for the vaccine. But what we have is we need to have it. But we are proud that our industry, pharmaceutical industry, is ready saying we'll manufacture and give it in a very short time. The moment it is approved, it will be available for people in a very short time. That short time is, I think, from the time, I don't know the time when it's going to be available saying, yes, this vaccine, you go ahead, but they are ready to give in a matter of few weeks. So that is a great news for us.
There were unfortunate reports of many hospitals fleecing patients and indulging in overcharging and black marketing, even by the reputed institutions. How do you respond to all that?
I think it's very unfortunate. See, in every society there is a black dog. If something happens at one time, or if we cannot think, we are not gods. We do our best, brought the best technologies to the country to give the best healthcare that's available for them anywhere in the world. It is not just Apollo. 40 years ago, what was not available today, we can compare ourselves with the facilities that are available in healthcare anywhere in the world. I am a cardiologist. I brought Apollo because I lost an young man who couldn't afford to go abroad to pay $50,000 those days. Today, we are doing heart surgeries for $4,000, $3,000, and the government of India is still saying that you must still reduce and give it to a larger number of people. But it's not the numbers in healthcare. We've done more than the biggest centers in the world, 187,000 doctors. Our doctor, Girnath, the first cardiothoracic surgeon, has done over 60,000 heart surgeries and brought this so-called beating heart surgeries to help people. So we advanced the technology apart from the numbers. For cancer, we have brought facilities that is available in the best centers anywhere in the world. We have, for example, we have brought the latest diagnostic facilities. Now, recently, we have brought state-of-the-art proton, which is, for this part of the world, is the first of its kind, comparable to any best oncology centers in the world. But what do we do when we treat these patients with oncology or heart surgeries or strokes? All of these come to them with the same or better clinical outcomes, but with care and compassion, and at cost nearly 1/6, 1/5. So, but constantly they criticize, unfortunately, because a few people do something wrong. But they never criticize, let's say, a hotel. If somebody you can get a cup of coffee on the street, you get a cup of coffee in the two-star hotel for 15 rupees, but it's charged 150 rupees in a 5-star hotel. But that's because that is their cost. So that's why, because from a small nursing home to a secondary care, tertiary care, quaternary care hospital, there are significant impacts. We can't give the same because the care that we have to do for transplants, for example, we again have become the largest, Apollo has become the world's largest organ transplant center in the world. We have done the largest number of renal transplants, with all of them not with outcomes better than the best in the world. But what we are happy is the cost is not $150,000 to $200,000 for a transplant. It's 1/5 or 1/10 in most of our transplants. But giving them the same outcomes and the price. I think this is where I'm happy
What are your suggestions for the Indian economy? How long will it take before normalcy comes back to India?
I think India was progressing. There are several steps that have been taken by the government from the 21st century onwards. Many things have happened. But what the present government has done in this COVID crisis, the world over you are seeing, they doled out not millions, they doled out billions and trillions. But what our government has done is also remarkable. Several lakhs of crores they have given. First, number one, people who need it at this time, people who are helpless, who can't even get their next meal. For them, they have given all possible help. But what is more important is, in every single way, we said the other thing which our Prime Minister announced, Atmanirbhar. So we should develop our own technology, because Indian is a very clever person. I think we're clever than anybody in the world. Probably only one sect which I know, one nation which I know is a little more clever than us. Not because of our brains, because all our brains are equal cost, several trillions of dollars, billions of dollars. But the thing is, they are focused. If we are only focused, we could be the best. But I think this is why the government now is focusing, saying we should develop within our own country all possible things. And this is where the many things that the Ministry of Finance have done, and our Health Ministry has promoted several things. But I think the last announcement by our Minister of Defense saying over 1 lakh crores of imports will be stopped so that they could be manufactured in the country. So this is our goal. Is our goal, and I think we have shown it before. As I said, in healthcare, we have shown that we could be equally the best as is possible. But we have also tried. Every time I meet the major global suppliers, whether it's GE, Philips, or everybody, I say, all right, you are telling me the latest equipment, but you tell me when you are going to bring this equipment to us. I still remember, I bought the first CT scan in the country, the first MRI, first PET CT, the first, name it, and now the first proton in the world. And in a few more days, I'll show you one more thing we'll inaugurate next week for the first time for this part of the world. So I think we need that technology, but I think we need to also see it develop. They used to tell before, I remember the GE chairman used to say, Dr. Reddy, the numbers in the country doesn't approve. That time I was one CT scan. Today, India has several thousands of CT scans, buys several thousand scans, and they can export from India. What they have done for ultrasounds, they have done for X-rays. So this is where I think I'm happy that they are putting this pressure so that we should manufacture majority of the equipment within our country, especially which is used for a large number of population, and so which you can export for earning the valuable foreign exchange. So some of the technologies you can still import for some time. So I have great faith in our nation, because we have not failed even before. India was ahead in several things, and now after independence, rapidly we are developing. And I think this decade is going to see a tremendous thing in healthcare.
And coronavirus cases are increasing every day in India now. How big is that a concern for you?
I think if you look at this, in the beginning, for the first 3 weeks, for first four weeks, till April 15th from 25th, for 3 weeks, we had about 1,000 cases, whereas US had, for the same time, more than 11,000 cases. Today we have 2 million cases, US has got 22 million cases. 11 million cases. But the thing is, what to wait that thing is, apart from the steps that have been taken from the government for, the several lockdowns that they have done, which has made a very significant impact. Fortunately, some of this labor moved along, because for them it's livelihood. So when there was no livelihood, they moved. So that has spread. The second thing also was the diagnostic kits were not available. Government tried its very best to buy from anywhere, but then that also made a slight difference in delaying the greater number of cases. Today, they are doing tremendous number of ranks, and as I said, the health minister the other day talked about saying we already have 1,340 centers in the country which are doing COVID testing. That means anybody in the remote village maximum has to take about 2 hours. So this is in Chittoor, my district headquarters. Never heard of. We're doing COVID testing now because the government has given us the permission and the wherewithal to do it. So I think it took a little time, not because we were negligent, because it was not available. You know, the diagnostic kits were not available. Diagnostic equipment was not available immediately because this is an unexpected pandemic. You know, so I think it is progressing, but we must give all the credibility, given all those hindrances, that the government has made tremendous efforts in the lockdown, in bringing the availability of all these kits for treatment, as I said, the PPEs and the ventilators and all. So it is, you can give the best care for our people, and then getting all the diagnostic. Same thing they are now doing. The moment the drug is available, they have permitted very liberally if it's working a little, but we don't know whether that is going to be the drug of choice for. But at least it's helping a majority of the people if given in the right time.
Do you see a revolution in the healthcare sector coming post-coronavirus in India and around the world, as there will be an increase in consciousness and even funds will be aplenty for medical services, as it will be a priority for many nations?
You know, everybody, for everyone, from the time we are born, the mother cares for us. Then the parents look after you. Then previously there was a single doctor in a village, Ayushman doctor, who used to look after you. But today, it's totally different. You know, it is the individual who must look after his health. You know, especially the NCDs are growing. The World Economic Forum said, and then UN, everybody saying, this decade, that is the second decade of this 20th century, is going to see 80% of the deaths. At the end of 2030, they say 80% of the deaths will be from NCDs. What are these? Diabetes, heart attacks, strokes, cancer, and infections. I add a sixth one to it, obesity. Yes, we don't have the obesity like the same in the Western countries, but our numbers are big. You know, so I think I know once I got into a lift, father, mother, and a daughter got in. The lift won't go up. I got out, then the daughter got out, then only the lift went up. So I think even in India, obesity is there, our numbers are there. So I add that as another additional non-communicable diseases, which we need to take great care. And that care can come from the hospital for treatment, but for the individual, for him to say, I need to be healthy. I need to know the health of my status of my health, and I will look after it. I will, my home can give me good food. I have, intelligence to keep myself healthy. So I will do my exercise. I think there are 2 steps. The diet, exercise, and a little discipline will bring down. And I really want to see the day when India proudly can say, we have reversed this verdict which was pronounced by World Economic Forum and World Bank, the United Nations, that 80% of the deaths in this decade will be from NCDs, costing $30 trillion in the world and $3.8 trillion for our country. Can we afford this? And why should we especially? Even if we can afford it, there are better things to do with that kind of money.
It was a pleasure talking to you, Dr. Reddy. Thanks for joining us.
Aditya, I think it's wonderful talking to you. The world is one.
So today we spoke to one of the pioneers of private healthcare sector in India, Dr. Prathap C Reddy, who has welcomed Indian government's response to coronavirus pandemic. And he is of the view that India has handled the crisis in the best possible way. Thanks for watching us.